Hello everybody, my name is Deirdre McGrath. I'm the head of the School of Medicine at the University of Limerick, and I'm also the course director for the Masters in Health Professions Education. I've been asked to talk to you today about our Masters in Health Professions Education programme. And by way of introduction, I thought it would be useful just to give you an oversight of our university and some of the unique features of that particular institution. The University of Limerick itself was established in 1972 as a National Institute of Higher Education here in Ireland, and it obtained university status in 1989. As a result, it's a very young institution, but has a proud record of innovation in education and excellence in research and scholarship. It was the first university in Ireland to introduce modular-based programmes, the first to introduce cooperative education and a credit-based transfer system, and also the first to introduce graduate entry to many of its healthcare programmes. It has pioneered, therefore, a range of innovations in the Irish education sector to date. Moving on then to the Masters in Health Professions Education. This particular programme was established in 2018. At that time, we realised that there was an increasing demand amongst doctors and other healthcare professionals for the acquisition of a formal education or a formal qualification in health professions education. Many of us would have, I suppose, taught students and trainees while working in the clinical setting, and I suppose in an age of increasing accountability, we've become more aware of the fact that there is a requirement for a more formal qualification in the education setting. The programme is particularly unique in that it has been designed by a multidisciplinary team within our Faculty of Education and Health Sciences. So we have had individuals not only from the School of Medicine, but also from our School of Education, from Nursing and Midwifery, and from our Allied Health School, who have contributed to this particularly unique programme. The programme has been designed specifically to meet the training needs of busy healthcare professionals, both locally and internationally. We believe the programme fosters attributes that are necessary for graduates to step beyond their disciplinary boundaries, and which allow them to interact effectively with people from other backgrounds, cultures and specialisms. The programme is flexible. It has been specifically focused on the area of medical and clinical education, and it's very much about informing healthcare professionals who work as educators within their own professional setting. The programme is delivered in two formats. There is a blended learning format and also a distance learning format. The reasons for these two methods are, I suppose, as follows. With regard to distance learning formats, it certainly meets the needs of many healthcare professionals who cannot come on site for some of our blended learning or study days. The blended learning format is therefore also not only for people within the region, but people across our country or even abroad who like to meet and interact with other healthcare professionals, managers, in order to be able to brainstorm and to, I suppose, tease out more difficult concepts. The beauty of our particular programme is that our distance learners also have the opportunity to engage with the actual study days. They have access to the relevant resources, and they can actually come in online on the day if they find 24 hours beforehand that they're actually now available to attend. The programme itself is a 90 credit programme which is delivered over 2 years, and it has been specifically designed to allow individuals not only to acquire the relevant understanding and skill set around teaching, but also allowing them to progress then through the stages that give them the relevant skills necessary to become educators, delivering and developing on curriculum design, becoming leaders in the area of health professions education, and moving on then into the scholarship and the evidence, and understanding the evidence and developing the evidence to support education instruments and education curricula that they may be developing and designing going forward. So here we have a kind of a schematic diagram of the programme structure. As you can see, in year one, There are 5 specific modules. The first module is very much around learning and teaching and understanding the basic fundamentals and principles behind why we do things in health professions education. We then move on into education support, how we support our students and our trainees as they go through their programs of education. We have a module on assessment and how best to design and deliver assessment based on the curricula that we are involved in. And as mentioned, we move then on into the educator component of the programme, developing how we actually develop and design curricula, how we lead and manage individuals in the health education setting. And then finally, we move on into kind of the methods behind research and how we actually acquire and collate the evidence behind what we are doing. And this is obviously evidence-based clinical practice, I suppose, is what many of you will be have a very firm understanding about. But equally, it's equally important to understand the evidence behind why we use particular methods, why we use particular assessment instruments in relation to health professions education. The final 2 semesters are very much focused on progressing a research project that is relevant to your clinical practice with the aim of producing either a thesis by publication or a monologue thesis. So at this point,